The idea was that, well, the family doctor ordered a lot of tests, sent people to hospital.
Banff, Alberta, January 1992. Health ministers from across Canada met to take on what was perceived to be a national crisis. Too many doctors.
Dangerous to your health, fatal for your taxes. Canada has too many doctors, and that may be the real threat to Medicare today.
The health ministers hired veteran health analyst Maurice Bearer, along with colleague Greg Stoddart, to find ways to cut costs.
They were in a hurry. They were, don't know whether I'd characterize them as desperate, but they seemed desperate.
The Bearer-Stoddart report made over 50 recommendations and warned governments to consider all of them together as a package. But the ministers ignored most of the recommendations, focusing only on ones that saved money fast, like slashing medical school enrollment by 10%.
And so there are statements right in the report that says, if you do this, you also need to do that. And, well, as we all know, a lot was done on some things and nothing was done on others.
They didn't take the tough steps necessary to change how care was organized. So in a sense, the report was cherry-picked.
The Bearer-Stoddart report is often blamed almost entirely for today's shortage of family doctors. In fact, the problem was created by much more than a drop in medical school enrollment. Half of all the doctors in Canada after World War II came from other countries, mostly Europe. In the mid-'80s, when it was believed that there was a surplus of doctors, that inflow was drastically cut. And some provincial governments started telling medical graduates inside Canada that they had to practice in rural, underserviced areas. 19,000 doctors simply packed up and headed south. Half of them are still practicing there.
Around 2,000 to 4,000 of them are family doctors. And certainly that would go a very long way to address our shortage of family doctors if we had that number practicing here.
As early as the mid-'90s, the cracks begin to show. People report difficulty finding a family doctor, and things are about to get worse.
It sounds better, Ken.
Dr. Trinka is just a guy trying to retire from family practice in Chatham, Kent, Ontario.
Yeah, but you look better than
He's the old-fashioned cradle-to-grave kind of doctor who still does hospital rounds. He's also part of an alarming demographic fact. 1/3 of family doctors are boomers, approaching retirement just as Canada's aging population needs them most.
Nice. How are you this morning, Roz? You got something to eat at least, eh? Yeah. Oh, you look better.
You think so?
I think so, yeah.
Your eyesight's gone.
My eyesight's gone? I think our generation are dinosaurs. Buongiorno, Ted. I think the type of comprehensive care we gave is a thing of the past.
Yeah.
Oh, a little bit of bleeding there.
Well,
Dr. Trinka puts in 70-hour weeks, looking after an unbelievable 2,500 patients.
Back to you, doctor's office.
Well, let me check your blood pressure and take a look at you, okay? Get up here.
There's been some very interesting research at the University of Manitoba that documents that the doctors who are working the hardest in the system are over 55, and that they're working 30% more hours than the doctors a generation behind.
No, your blood pressure's fine, Gary.
Is it?
Yep.
Dr. Trinka is used to working hard, but during the past 10 years, the demands on his time have kept multiplying. Advances in medical knowledge and technology means there's more a doctor can do for his patient, but it all takes time.
It's like a rat on that circle, just going, the more I do, the faster I have to go, and the more I do, the faster it gets. I think in the early years, there was more blind trust in the doctor. Nowadays, I think people are more questioning.
So ask your doctor about controlled-release formula Ambien CR.
Drug advertising blasts consumers with advice, effectively telling us what to tell our doctors.
One regret. I just wish I'd tried Rogaine sooner.
And of course, there's the internet.
Most of us are well educated enough to be able to handle medical knowledge at a fairly sophisticated level, and you come into your physician with 200 pages about your one disease. You imagine if you've got 30 patients in a day who do that.
I find I'm bombarded with demands. Patient demands this test, I want that referral.
So the practice of family medicine has become more and more stressful. Yet for Dr. Trinka, retirement is bittersweet. He feels he's abandoning his patients.
Unfortunately, the majority don't have doctors. They're going to be orphaned. Okay.
Wonderful retirement.
Thank you.
Enjoy. Don't go and get sick on me.
I
don't know a doctor to refer you to. To find another one like Dr. Trinka would be like finding a diamond on the pavement.
Trinka tried for 3 years to find someone to take over his practice. No takers. Couldn't sell it. Couldn't even give it away.
They probably look at my patient profile. It's elderly. It's a heck of a lot of work. And they wouldn't want to take on 2,500 patients. They wouldn't want the complexity and nature of my practice.
Al Trinka is one of some 3,800 Canadian doctors expected to retire within the next 2 years. Conservatively, that means 5.7 million more people will be looking for a new family doctor. Dr. Linda Slocum used to be a family doctor, until she burned out and left family practice altogether. Today, she practices low-risk obstetrics at Foothills Hospital in Calgary.
I think bit by bit the value of the family doctor within the healthcare system became less and less.
That family doctors feel undervalued came through loud and clear in a 2003 Maclean's survey. 52% said if they were starting over, they would not choose the same career. Too much work and too little money.
In family medicine, it's fee-for-service in most cases. In other words, I get paid for what I do.
There are disincentives in the system. You know, the major billing code for physicians is a partial examination. And a partial examination probably gets you in the neighborhood of $30 or $40. Well, if the usual partial examination and service is a 3-minute encounter that terminates with a prescription, that's reasonably well paid. If you have to talk to an 87-year-old who has some cognitive impairment and 5 chronic diseases, and it takes you an hour, you still get your $30. That's a money loser.
For Linda Slocum, Alberta's booming economy actually made it harder to earn a living. Her costs went up, but her fees did not.
So then you really got to feel that you're on a bit of a rat race. You know, how many people do I have to see today to pay the overhead? And I wasn't willing to sacrifice time with patients to run a more efficient business. And that was really where I just decided I can't do it anymore.
We essentially have organized the payments so that we reward bad practice and we penalize good practice. And it isn't big bad government who does this. It's doctors.
Here's how it works. Ottawa transfers money for health care to the provinces, who then decide how to spend it. Some of it goes into negotiations with the Provincial Medical Association for increases in doctors' fees. It's the Medical Association that decides how the money is split between specialists and family doctors.
The long and the short of it is, medical associations have been screwing family medicine for a couple of decades.
Some specialists, like ophthalmologists, gross more than twice the income of the average family doctor.
Family medicine is the poor cousin, and it comes home to roost.
In 2006, Dr. Slocum was just one of 41 Calgary doctors who left family practice.
You can work around it.
In an attempt to play catch-up, governments are trying to get more doctors into the system. These international medical graduates are all now part of the University of British Columbia's Family Practice Residency Program.
You don't have time to go over everything. You can just refer out. Again, if you have somewhat kinesiologists.
Across the country, all provinces are trying to streamline the process that assesses and accredits foreign-trained doctors so that more of them can be licensed to practice in Canada.
So today, what we're going to do is we're going to talk a little bit more about the 5 most common problems that present to a family physician's office.
And universities across Canada have increased medical school enrollment. Today, there are 50% more students entering medical school than there were 10 years ago. Good news on the surface, but family medicine has become so unpopular that only a third of these students will choose to become a family doctor.
When we think that we need between 40 and 50% of our healthcare system to be made up of family physicians, there's a mismatch there that's not going to be resolved if we continue on the way we are.